First, let's welcome Dr. Jordan Glaser of Novant Health Orthopedics and Spine. Welcome to the show today, Dr. Glaser. What a privilege to have you here. Thank you so much for taking time out of your day.
Well, thanks for having me.
Well, it's going to be great. We're going to learn all about you and what your practice is going to look like. And but first, let's start with you.
Okay.
So tell me about yourself and your background. How did you become a doctor?
Okay. Well, starting at the beginning, I guess my name's Jordan Glaser.
Yep.
I'm an orthopedic spine surgeon. That's my specialty. And that's going really pretty far back, really, in terms of, well, my mom told me to be a doctor.
Oh, your mom did.
So that's important.
Okay,
right?
you always tell what your mother tells you, right?
And then also, really, I was initially inspired to be a doctor once I had a role as a healthcare provider in the form of a first responder.
Oh.
Okay. So, back in 2001, right around the time in New York, where when the Twin Towers were hit.
Right.
During that time period, I was actually taking my EMT course.
Nice.
And as an EMT, I first began to interact with patients and take on that role as a responder and be that one person or part of a team intervening to make a difference in an emergency, and that just grabbed me.
Yeah.
So from that point forward, even though I had already been studying hard and working hard in school and going through those early steps to try to get where I wanted to go, that experience solidified my interest and made me certain that going the direction of healthcare was good for me.
That's an amazing story.
So that was the beginning.
Yeah, wow. So where did you go to college?
Dartmouth College. Mm-hmm. So that's up in New Hampshire.
Right.
And I was a recruited athlete to play baseball there. And it was a great experience, although it was a little cold.
Yeah.
Maybe that's one of the reasons why I moved south. But I was a recruited athlete to play baseball, and things were going well until I began to run into injuries and arm trouble and shoulder issues and so forth. And of course, like many young athletes out there, we wind up seeing our fair share of orthopedic surgeons. And that was another step towards, I think, focusing me in maybe what field I wanted to pursue as well.
Yeah.
So,
where did you do your residency?
So residency, after med school, I moved to Philadelphia. A big factor in medical school is choosing what specialty you want to pursue, and then going through this difficult match process, competitive match process to get where you want to go. And I matched into a great program, Drexel Orthopedics, which is in the heart of Philadelphia, and lived there for 5 years. And during that time, kept narrowing down my interests and chose to pursue a fellowship in spine surgery.
Was there something about spine that really drew you in as opposed to general orthopedics?
Yes, as we move forward, I think through probably almost any career, you kind of find your strengths and you find your interests, you find what grabs you. Perhaps you even find an excellent mentor along the way if you're lucky enough to. And all of that experience and people around you kind of help guide you. And yes, what stuck out about spine initially was that interplay between the neurologic system and the musculoskeletal system. And there's quite a bit of diagnostics involved in treating a spinal condition. Not just necessarily the imaging studies that people might think, an MRI, things like that. Yes, we use those as tools to confirm our clinical suspicions. So really a major component of spine is gathering that history, really knowing where the pain is, what's going on, what's driven that patient to seeking out a spine specialist, and what brought that person to the office that day. You really, there's so much valuable information in a history for a spinal issue that it's key. That and physical examination findings. So there's a heavy emphasis in spine on those interactions, on those in-depth evaluations, and that deductive work on the diagnosis side.
Right. So I believe you came from Mooresville most recently.
Yes,
Is that
I
right?
did,
From
yes.
Mooresville to here. And so
Right.
what brought you to the beach?
Oh, just a fantastic opportunity, really.
It's the lifestyle, right?
Well, that's a perk.
It
You know,
is.
that's a perk. Being on the coast is a perk. I'm originally from New York, but the part of New York that I grew up in is Long Island. So that's an area where there's a lot of coastline.
Sure.
There's a northern coast along the Sound.
Yeah.
There's a southern coast along the Atlantic Ocean. So there's beach. There's salt air.
Right.
There's
So
that
it's
kind
sort
of
similar.
feeling, right?
Yeah, you probably feel right at home.
I do actually.
That's
I feel
great.
very at home on the coast. But even bigger than that was the opportunity to come here with Novant and build an orthopedic practice.
Right. And that's what I want to talk about.
Sounds great.
So, first of all, I want to say how glad we are that you've chosen this area and Novant Health Brunswick Medical Center to become a part of that. We're really excited to have you here, and it's a very exciting time for Novant Health because this is our first orthopedic practice.
It is.
So I would like for you to tell us a little bit about your practice.
Okay. Well, thank you, and really it's a privilege, and it was an easy decision
Well, that's nice
to
to
start.
hear.
It was an easy decision to join the team here,
It's a
and
great
also
team.
and also make the move.
Right.
Right. And yes, so it's an exciting time. We are building an orthopedics practice. Within orthopedics, not everyone may know this, but there are different specific
Sure.
subspecialties, even within that subspecialty of
Right.
surgery. So within orthopedics, there are sports specialists,
Mm-hmm.
total joint replacement specialists, spine specialists like myself, trauma specialists,
Right.
hand specialists,
Yeah.
pediatric specialists, right? And as we grow, we can add different specialists for different needs. I'm filling the role of the spine surgeon here.
Right.
I also take general orthopedic calls. So in addition to our fellowship training, which highly specializes us, we all go through that 5-year residency where we learn a wide breadth of orthopedics
Right.
and can handle many of the common problems that present in our emergency rooms
Right.
and or maybe pop up on a sports field, or you name it, in terms of basic injuries or fractures, which are
Right.
broken bones.
Right.
A fracture is our fancy word for a break.
Right. And I understand that the practice will be adding additional surgeons
That's
for
correct.
other subspecialties. Is that correct?
That's absolutely correct. Yes, we are building. We're building monthly in our scope. In addition, you know what I'd like to add is that in addition to the surgical component, which we
Right.
talk a lot about in terms of spine, what I've incorporated into my own practice are also the smaller, less invasive procedures for pain, which typically do involve injections. But the nice part about having that within our spine practice and performed by me, by the surgeon,
Right.
is that we can take care of, we can offer a more conservative aspect also to care. And there are many conditions that are not necessarily indicated for surgery,
Right.
meaning that not everything is fixed with an operation.
Right.
if
And I
that's
think
clear.
our viewers would be really interested in that that component because surgery, back surgery or spine surgery is a very serious matter. And before you do that, I would think I would want to try other methods.
Right, and depending on the problem,
Sure.
that determines what direction we need to go.
Yeah.
But you're right, and to put everyone's mind at ease,
Yeah.
to put everyone's mind at ease, it is oftentimes not a quick rush to an operating room anyway.
That's
We have
good.
to
That's good to
find,
hear.
we have to figure out what the real problem is, and then we go through the different options that are best to treat it, starting with a conservative aspect. Could be physical therapy, other non-invasive treatment protocols,
Right.
home exercise regimens.
Right.
We can tailor a lot to the patient, to their condition, their symptoms, their lifestyle, and so forth.
Right. That's all great information. And interestingly enough, we will be meeting your new partner shortly.
Okay, excellent.
Dr.
Excellent.
Ricardo Valle, who will be joining us soon. And so I'm anxious to talk with him too and to see what he has to offer. Let's talk a little bit about where your practice is located.
Great. It
is, I believe, at 6 Doctor Circle?
It is, yep.
And
6
Suite
Doctor
5.
Circle, yes, 6 Doctor Circle, Suite 5 in Supply.
And that's right next
Supply.
to the old hospital.
It is. It's very easy to find. It's right on 17,
Right.
so you can get to us easily, really, from the north or the south,
Right.
just coming up 17.
And you are accepting new patients.
Welcoming, absolutely, welcoming new patients, for sure.
And does it require a referral?
No, no. If I like to kind of keep a very open door policy in the practice. If
Nice.
a patient has a concern, if they have a condition that's been ongoing, then it's a simple process. They can just call, schedule an appointment, and we can go from there.
Right. Well, that's all wonderful information. I'm so excited that you were here today, and I look forward to having you back soon because
Excellent.
once you've experienced the area a little more and seen a few more patients, we'd love to have you back and tell us how it's going.
Well, that'd be great.
Thank you so
Love
much
to
for
come
being
back.
here, Dr. Glaser. It's been a pleasure.
Thanks, Gene.